For my PSA project, I chose to do oral herpes. What are oral herpes? Oral herpes are a common infection caused by the herpes simplex virus, HSV, predominantly by HSV1. This virus leads to the formation of painful sores and blisters around the mouth and lips, commonly referred to as cold sores or fever blisters. The pathogen responsible for oral herpes. The pathogen is herpes simplex virus. The type is a double-stranded DNA virus. It belongs to the Herpesviridae family. This virus can establish lifelong infections in the host nerve cells, leading to recurrent outbreaks. Overview and facts. The modes of transmission. It spreads through direct contact between contagious areas and broken skin, such as a cut or a wound, and mucous membrane tissues, such as the mouth. Some common methods of passing are kissing, sharing eating utensils, personal items, close physical contact, and touching the sore. Herpes can also be transmitted when there are no symptoms present. There are several days throughout the year when the virus reactivates, yet causes no symptoms. This is called asymptomatic shedding. For mortality rates, it is extremely rare and usually associated with severe complications, such as those with HIV or AIDS, cancer patients undergoing chemotherapy, or organ transplant recipients. HSV encephalitis is a serious and rare complication where the virus spreads to the brain, causing inflammation. If left untreated, it can result in a mortality rate of 70%, and only a minority of individuals recover fully without residual deficits. For morbidity rates, it's estimated that 67% of the global population under the age 50 have HSV1, and around 20 to 40% of individuals with HSV1 will experience recurrent cold sores. For origin, the HSV1 strain arose around 5,000 years ago during the Bronze Age, possibly driven by the introduction of kissing as a cultural practice through migration. For affected regions, there's around 49% for women in America and 39% for men. In Africa, it is around 87% for both men and women. For the Eastern Mediterranean, it is around 75% for both men and women. In Europe, it is 69% for women and 61% for men. Southeast Asia, it is 59% for women and 58% for men. And in Western Pacific, it is 74% for women and 73% for men. Signs and symptoms. Some signs are visible sores or blisters on the lips, mouth, or gum, and swelling and redness around the blister. Some symptoms are pain, itching, burning sensations before the sore appears, fever, headaches, and swollen lymph nodes. For diagnosis and prognosis, for diagnosis, recommended a physical examination to examine affected areas for characteristics of sores or blisters, a PCR test to detect the presence of HSV genetic material, and a blood test to analyze for the presence of HSV specific antibodies. For the prognosis, being a lifelong condition, it remains dormant in the body and can reactivate periodically. The first outbreak is often the most severe and can last 2 to 3 weeks. Future outbreaks are typically milder and shorter, usually lasting 5 to 10 days. While the virus remains in the body, outbreaks become less frequent and severe with time. Using antiviral medications can help reduce frequency of outbreaks. For treatment, you're going to using a over-the-counter medication such as ticosinol, and it can help shorten healing time. The use of lip balms or creams with sunblock can help prevent recurring infections, and taking ibuprofen or naproxen can help with pain and fevers. For care, it is important to maintain a healthy diet to support overall health and to keep the affected area clean and to avoid picking at the sore to prevent any secondary bacterial infections. For prevention, avoid direct contact with sores and avoid sharing personal items. Practice good hygiene and use antiviral medications as a preventive measure in high risk individuals. Thank you.